update for Simcoe, Muskoka. So as of this morning, we have 480 cases, up from 476 yesterday. This is actually up 12 cases since I last reported on Friday. 11 of these 12 cases reside in Simcoe County and 1 in Muskoka. We continue to see a reduction in our weekly count of cases, which is, of course, a very good thing. So far this week, since the weekend, we have the 12 cases. The week before, we had 26 cases. The week before that, we had 40. The week before that, we had 44 cases. And the week before that, we had 74 cases. So a good downward trend, I would say. But I'm always cautious about this, that this has been due to our diligence and hard work together to flatten the curve, to maintaining our physical distancing, people keeping 2 meters set back from other people when they go out, hand washing frequently, being careful about going out. I've always said it's important that people go out and be physically active, but do it in a careful way with the physical distancing. Be careful about your shopping approach, strategic about it. Do it once in the week if you can, one household member to do so, and to practice the safe approaches that we have up on our website about that, and that if you develop any symptoms, that you should self-isolate and seek out assessment and testing. That the assessment centers that we have here in Simcoe, Muskoka are receiving people in accordance with direction from the province and testing people with any symptoms or those who are concerned they may have been in contact with someone or are at risk. And that we need to keep all of that up so that we can continue to bring down our cases, continue to reduce transmission, continue to have control here over the pandemic. Of the 4 cases that have occurred since yesterday, 1 was male and 3 are female. Their ages range from 20s, 60s and 80s, I should say, 20s, 60s, and 80s. So there's 1 individual who's admitted to hospital, to RVH, a person in their 80s, and 3 others are in self-isolation, recovering at home. 3 of the 4 are close contacts to another known case, and 1 is under investigation, and they all reside in Simcoe County. We've had 19 people newly recovered, so this makes a total of 397 people recovered, or 83% of all of our cases, and that this percentage is growing over time, which of course is a very good thing. In May the 22nd, at that point, only 74% of our cases had recovered. Right now we have 8 that are hospitalized, 3 in the intensive care unit. We've had no deaths since I last reported, so we have our total of 36 deaths. We have 1 long-term care facility outbreak, and that is at Owen Hill Care Community. I had reported on Friday that all of our outbreaks were finished, that we had none, and then later in the day it turned out that we had had an additional case at Owen Hill, a staff member, and so we put them back into being considered to be in outbreak status, and we've had no additional cases since that time. Okay. We don't have anything more to report with regards to outbreaks, which is, of course, a very good thing. And as always, I'd like to draw people's attention to our Health Stats website, where you can find a lot of in-depth information about our cases and how they break down in terms of location of transmission, in terms of age, in terms of risk factors, in terms of how that's changed over time. I'm now going to turn to our media notes. The province has released a testing strategy document, And it is very broad indeed. It speaks to response to outbreaks, it speaks to surveillance, and it speaks to proactive testing of asymptomatic individuals in a variety of settings, a variety of backgrounds. It's very inclusive, I would say, of the people to be tested, very open to people coming forward to be tested. If you look at the individuals that are listed to be tested, they include people who work in long-term care facilities and retirement homes, other congregate settings such as correctional facilities, group homes, homes for violence against women, child residential sites, anti-human trafficking residential sites, indigenous healing and wellness facilities and shelters, youth justice, residential facilities, supportive housing providers. Like I said, a very long list of locations where people would be working, people who work in essential workplaces, agro-food businesses, supply chains, food, customer products, services, financial services, telecommunications, transportation, manufacturing, agriculture, sports, recreation, media, basically almost all inclusive. And then in this document there's types of priority populations as well, which largely reflect these work environments, the people who work in these work environments, also First Nations and Indigenous communities, and the general public as well. So very, very all-inclusive. For me, what's critical is that people who have symptoms need to be tested. And you really only need one symptom that you should be coming forward to be tested or be assessed. People who have had contact with an individual who's considered to be a case, we will be approaching you. We approach all people with positive test results and then approach their contacts, and we provide requirements for them to go into isolation for 14 days. So the contacts would need to go into isolation for 14 days. They would certainly need to be tested if they develop symptoms. There's now more inclusive recommendations that even contacts without symptoms can be tested as well, but they can't rely on a negative result. So if somebody's been in contact of a case and they're in isolation, if they get tested and they're negative, they still need to remain in isolation for the full 14-day period before they can come out of isolation. And if they develop symptoms again later in isolation, they need to be tested again to see if they are a case. So those people certainly would need to be priority. When we're investigating an outbreak, whether a long-term care facility, some other healthcare facility, possibly now work environments, businesses, we would be advising as to who we think needs to go in isolation, and we would be advising also whether it would be helpful for them to be tested. And even in those situations, if we aren't advising that it would necessarily be helpful, people still have the option to seek it out for themselves at the assessment centers and get that done. It's just, like I said, a negative test result in such situations does not mean that you can come out of isolation. If you were put in isolation, you need to remain there for the full 14-day period. So obviously, our assessment centers remain critical as a place where people can go to get all these things done. I think it'll be important for us locally as healthcare providers to look at how does this change over time, whether we have changes in how and where we locate, how we operate assessment centers, whether they become more treatment centers rather than assessment centers, whether there are more locations in which people can get tested in the future. There's testing protocols that could very well come out about healthcare provision for people that have to be admitted to a hospital for elective procedures. There will be a screening process for them and possibly testing associated with that. What I'm seeing is a likelihood of a requirement for people to go into home isolation for a 14-day period before they go in for such an elective procedure as a way of safeguarding the healthcare environment and avoiding inadvertent transmission in the healthcare environment. So lots of implications for us, a lot of work for us to continue to change the system, to accommodate more testing in the way that the province wants, to make sense of it all for people so that it's helpful. There's now also a requirement from the province that those who work in long-term care facilities need to be tested every 2 weeks, that the facilities themselves will be responsible for making that happen. So yet another example of a broadening of the testing protocol, testing requirements from the province. And even the potential for mobile units of some kind to facilitate testing geographically. So we shall see how that plays out. There's also a protocol, a guideline for from the province for day camps. And I know that our municipalities have been looking for this because they operate these day camps. They're very important, I would say, for children's well-being in the summer to have this kind of activity. And so the province has agreed that they can take place provided that they put in place control measures to help avoid infection, help make them safer. The municipalities have been, and other operators have been needing this guidance, so it's just come out and we're just making it available to the providers, to our municipalities to be able to carry that out. But it includes screening of children and workers on a daily basis, and excluding those that have symptoms and referring them for assessment and testing, and certainly identifying any children or workers who become ill while they're at day camp and referring them for assessment. Follow up if there's ever any exposure at any of these camps of children to somebody who is probably or has been found to be a case, and how they are then to be managed about isolation at home or follow up for testing. Keeping the group sizes down to no more than 10 in total, and avoiding contact between groups of children so that if you get an exposure at a day camp, it's limited to the one group and not to the whole camp. A lot of requirements with regards to sanitation and cleanliness, the promotion of physical distancing at the camps, and even the use of masks if there's close physical contact between individuals, and prohibition of group travel together in a single bus, because that would challenge the ability to physically distance and challenge the limitation of the group in terms of its size. So a lot of requirements in place in order to have these operate safely. Some other questions? We had a question that was asked in early April. How many clients have tested positive in Simcoe, Muskoka, but actually reside out of Simcoe, Muskoka? So people who had gotten tested here but then didn't remain here. And there could be instances where people work here, therefore it was easier to get tested here, but they actually live out of area, and so they went back to their home as an example of how that could have happened. So before, on April 1st, I reported that we had 33 cases who had tested positive in sites in Simcoe, Muskoka, who did not remain here while they recovered. And so now that number has risen to, by the best of our count, 52. I would also say that there have been 16 individuals who have live elsewhere, but actually were recovering in Simcoe, Muskoka as well. That's kind of the opposite situation of the figure that I gave you before about the 52 cases who were tested positive here but recovered elsewhere. So at this point, I'd be happy to take any questions.
Okay, thank you, Dr. Gardner. How about we start with Eileen Doyle from CTV. Eileen, you might be on mute. Okay, we'll come back to you. How about Ian McLennan at Barrie 360?
Yes, thank you, Dr. Gardner. With the emergency measures expected to be extended through June 30th, and of course the Premier has hinted about possible regional openings. With our area so close to two hotspots, Toronto and Peel region, are you eager for a regional perspective, or should it be province-wide when it comes to reopening of businesses, etc.?
That's a good question. I think with a regional approach, it would be important for the province to take into account not just what's happening here locally, but how close it is to other more heavily affected areas. And that might very well influence their decision about what they do here. Right, so we shall see exactly how it will play out, but I think that would be an important thing to consider, because if we're allowed to open up services here that are not allowed to the south of us, there could be the potential of drawing more people here to use those services, and the potential for an area that's got a higher incidence of COVID having an impact on disease transmission rates here. So I think that would be an important consideration for the province to take into account.
If I could, just one quick regarding the case in Holden, Norfolk, now up to 184 regarding migrant workers. And we do have migrant workers that come through and work up in the Holland Marsh area. And I'm just wondering, Doctor, if your team has been in contact with, say, the Holland Marsh Growers Association, or what protocols might be put in place, just so we may not have a similar case as they do in Norfolk?
It's an excellent question. And I believe also in Windsor area they had an outbreak as well related to temporary foreign workers in farms, or migrant workers in farms. We've approached them all and surveyed them about the conditions under which they would be keeping their temporary workers, and have made it clear to them that they need to be kept in isolation for a 14-day period upon arrival to Ontario, to Canada, required by the Quarantine Act, and that they must report any cases that develop any symptoms for us to be able to follow up and ensure proper isolation and contact investigation. So we've got them all, we've got them enumerated, we've made contact with them all, and we do realize that there is a risk in this particular work environment. There's risks in other work environments that we're concerned about as well, that we're have reached out to. We need to be on the lookout for potential clusters of cases that could arise in work environments such as this, and we need to be also including that in our epidemiological reporting as well. So to date we've had no work-related clusters, but we know that that kind of thing has happened elsewhere in the province. It's happened in other types of work environments south of Simcoe, Muskoka, and other municipalities, and therefore, in addition to working with those environments to help reduce their risk, we will certainly be reporting if we get work-related clusters. We'll make it clear in our epidemiological reporting that that's the case.
Okay, thank you.
You're welcome.
Thank you, Ian. Eileen, are you back online? Okay, let's go to Nathan Schubert from Moose FM.
Nothing for me today, thank you.
Okay, thank you, Nathan. Don Huddlestone from the Huntsville Doppler, are you there?
I'm here. I was just... Sorry, can you hear me?
Yes.
Yeah? Okay, good. Dr. Gardner, just a quick clarification on what you said about people who tested elsewhere and are residing in this area to recover. They would be listed in your case count?
They are.
Okay.
We've taken that approach of including them if they're here while they're recovering. We include them in our case count.
Okay, thank you. And then in terms of workplaces reopening, we are seeing some workplaces here who aren't implementing any sort of physical distancing within their stores. So I'm just wondering if you can comment on what might happen as more workplaces reopen, if there will be more stringent requirements put in place that can be enforced somehow.
So the province's directives and its requirements for the safe opening of businesses is enforceable, and police, bylaw officers, public health personnel, and Ministry of Labor personnel can all enforce those regulations. It's not being done in a proactive way, though. We communicate out to them what's expected, but there isn't a proactive inspection process to make sure that that's happening. We're really relying on people to let us know when they're concerned, and when they do call us, we do work with others, the other enforcement personnel, police often, to determine who would follow up and assess the situation and see if there's anything that needs to be done in the way of recommendations or enforcement. I am concerned that this is a new front for us, a risk for us, and we have seen, not here, but in other health units, some clusters of cases or outbreaks of cases associated with work environments. I'm well aware that we will probably eventually see some here as more of them open up, and therefore we have to be prepared for that, and we have to do all that we can to minimize it, knowing that the more of it opens up, the more the greater the risk for us.
Great, thank you.
You're welcome.
Thank you. Thank you, Dawn. I'm Will. Hi. Okay, go ahead here.
Hello.
Hey, sorry, some phone issues. Okay, I just want to talk about, you were talking about that document from the province. Mm-hmm. What are the goals, or do we have a goal for Simcoe, Muskoka, how much we want to be testing? And how many are we testing right now? Like, how far are we from that goal? There is one.
So I'm not aware of a number, a target for testing. For me, what's most important is that we continue to reduce transmission. And we certainly have a target for being able to reach all cases within 24 hours. The goal is at least 90%, and we try to make it 100%, of all the cases that are reported to us. We contact them within 24 hours in order to put them into isolation and to find their contacts and put them into isolation. So that's a critical goal. Certainly important, therefore, that we're testing sufficiently to know about our cases so we can reach them and break that chain of transmission via that means. So for me, it's really important that symptomatic people be tested, and the people that we would advise because their contacts, particularly in outbreaks, are tested. I think the broader testing strategy remains to be seen how effective that is. It's, I believe, perhaps assumed that that kind of testing is helpful, but it may very well be that we get a very low positive test result yield out of that. We do know that testing done for staff and residents in long-term care facilities where there was no outbreak and those individuals had no symptoms gave a very low yield, about 2 cases out of 1,000 tests. So the broader testing of people with no symptoms, no contacts, will probably give you'll have many tests and very few positive results come back. And then we'd be having to determine whether they're true positive results or false positive results, which can be a challenge. Like, no test is perfect, so a certain number of tests are going to be false positives. If you're testing people of very low probability, very low risk, then you might get as many false positives as true positives when you do that. So we don't have a target target number. But just to answer your question about how many we are testing, we were testing in the range of 120, 130 a day at our assessment centers, and then it went up to 430 the Monday following, not this Monday, but the previous Monday following the Premier's announcement. It went up basically 3 or 4-fold and remained quite high through the week, though there was some decline. When I look at the numbers through the week, there was some degree of decline in the testing numbers, but they were still definitely through the week quite a bit higher than what we were seeing typically. So there's definitely been a boost of testing since the Premier made his announcement over a week ago.
Okay. And then just one quick follow-up. I don't know if this is relevant anymore because you said you don't really have a target, but is there anything that you would like from the province to improve, or I don't know if increase is the right word, but to improve testing? Is there anything that you're missing that you want from the province right now?
I think what's important is having a system that's sustained. So we've managed to set up these 7 assessment centers. That was done very quickly. It was done with a lot of teamwork, hospitals and primary care, and diligence on the part of those agencies and the people involved. As a health unit, we help foster that. The local health integration network helped to foster it. We continue to be connected to it, to support it. We have to be able to continue having a system for testing that will continue for the whole duration of the pandemic. And we're predicting that the pandemic will continue until we can vaccinate everybody, which we hope will be sometime next year, dependent on the creation of a vaccine and its manufacture. So we're going to need a system in place to be able to keep people, allow them to continue to be tested that whole time. And we've got to look at how do you sustain that. Hospitals that make a contribution of resources and personnel are going to be pushed now because they're ramping up their operations. They had to shut down their elective procedures and their surgeries. And now in Simcoe, Muskoka, because we're in a strong position for them to be able to operate, they are now going to be commencing all of that again. They're going to need their personnel again. The support that they can give to the assessment centers is going to be more limited. So to me, it's really critical we find a way to be able to maintain them. It'd be nice if we can increase the numbers of them or have other locations where people can be tested, more of them. Maybe it'll be possible down the road for some people in primary care, some family physicians, to be able to do it in their office, but they'd have to contend with the infection control requirements if they're going to be able to do that. And we're aware that the province is interested in creating mobile units, vans, buses that would be able to enable I guess an increased opportunity for people, another opportunity for people to be able to be tested that could be deployed as needed to areas that are identified and need it more. So we'll see how that plays out. But to me, the critical thing is maintaining and maybe growing the locations where people can be tested.
That's great. Thank you so much.
You're welcome.
Thank you, Eileen. Erica Engel from Hollywood Today. Do you have questions, Dr. Gardner?
Hi, yes I do. When you were speaking earlier about requirements for day camp, in Collingwood, sort of anecdotally, I'm still seeing a lot of day camps closing down, or canceling their summer program, just saying that they can't meet the restrictions. They can't sanitize craft equipment or keep kids separate enough. Are there day camps that are going to be able to meet these restrictions? And what kinds of activities are they able to do?
Well, it won't be the same, that's for sure. And frankly, I think that they will be challenged, and it is possible I have no doubt there'll be fewer. And it's possible that there'll be none. We shall see. When I think through what a camp normally looks like, and children having a lot of close interaction with each other, and being, free to enjoy themselves. I think it'll be challenging to be able to operate with these kinds of restrictions. So we shall see. I do know that the city of Barrie, anecdotally, I know they had put out notice that they were discontinuing the programming that they had already created and providing people back with their money for those that had signed up. I asked about that and was told that they will be looking at a revised approach. So they closed what they had before, and now they're going to be looking at how do they revise and continue on. So we shall see how that plays out.
Okay, and then I had another question. I was speaking to a local nursing home owner who said he was really happy when the province announced that they were sort of opening up who he could hire, because traditionally he's had a hard time hiring enough licensed PSWs. There's been staffing shortages, and he says he has more staff now than ever before. Do you think that through this pandemic that sort of change is necessary to allow long-term care homes to hire more people even if they don't have PSW licenses, or what's your take on that?
It's a good question. They certainly need access to staff, and they need to be able to keep them such that they can't work between facilities as an infection control practice. But I think we're going to see a deep review of how long-term care operates and how it needs to operate to be safe and healthy for the residents in the fall when the province does its inquiry, its review. So I think there'll be a lot more to come on that front.
Okay, thank you, Erica. Chris Simon from the Barrie Advance. Are you online?
I am. Thank you very much. Dr. Gardner, we've talked previously about healthcare workers and the number of healthcare workers that have become ill due to COVID-19 in the region, but I'm wondering whether we have any statistics around other potentially high-risk occupants.
Thank you for the question. We've given that kind of information before, so I could pull it forward again and provide the statistics that we gave before. We had, I think it was under 40% of our cases, we knew what their occupation was, and that the great majority of them were considered to be essential workers. If I recall off the top of my head, 2% of them were first responders. A very large number of our cases were actually healthcare workers, about a quarter of them, and the majority of them were actually associated with outbreaks in healthcare settings. So I think that says something about the nature of the risk for healthcare providers. But I'm now becoming concerned, I would say, about other work environments based on the experience of some other health units and based on the opening up the economy.
And then the other question I've got is on Central North Correctional Facility. Will the health unit have any role in monitoring what's going on there?
Yeah, so in that instance, there was an individual who tested positive. And indeed, it's a reportable disease, right? And we have jurisdiction everywhere that's not federal territory or First Nations territory. So we have jurisdiction there when it comes to reportable diseases of public health significance, such as COVID-19. And certainly if they have an outbreak, we have jurisdiction and we can issue orders if necessary to respond. At this point, we have the one individual. We've investigated and determined that there were no contacts of concern about transmission in that facility related to that one individual. We are aware that they're actually going to be proceeding with testing in the facility. We're not sure if that's because of their concern about this case or if it's because of the broader testing strategy that the province has put out.
would we, what types of protocol, when would you, let me rephrase this, when would you be looking at potentially declaring an outbreak in Central North? Increase in cases?
So with an outbreak, we're generally looking for evidence of transmission. So you have this one instance. If we had another individual that tested positive and there was any indication at all that there had been a contact related to this, then we'd be declaring it an outbreak. Or if there's any evidence that this person somehow acquired their infection on the premises, if there is no other explanation that they must have got it on the premises, then we'd be looking at calling it an outbreak and treating it as such.
Thank you.
You're welcome.
Okay, thank you. I'm just quickly going through my list. Seth Cross, were you online today?
I am, yeah. Showed up a minute late. Couple quick numbers, housekeeping issues before I ask my question. 16 mentioned from that are recovering in Simcoe, Muskoka. Those numbers do reside in the other healthcare areas, correct?
Yes, in that case, this was 16 individuals who from the very beginning of our pandemic have been here recovering. So they're not necessarily current cases, right? They're ones that, they're not acute. It's not within the past week or whatever. It's throughout the entirety of the pandemic. This is the number that have come from elsewhere, don't reside here, were tested here and recovered here.
I see. And would you have done contact tracing from your office? Yeah, your office.
We would be, in that they were here. It, of course, depends on the details, but we definitely would be assuring ourselves one way or the other that there were no contacts here, or if they were, who they are, so that we can follow up with them. And if there were contacts out of our jurisdiction in another health unit, we'd be referring the task of pursuing that to those health units.
All right, very good. Now, we've gotten a report of a bank in Gravenhurst that's closed due to concern infection. And I'm just wondering, is there any relation to our case that was reported yesterday, a man in his 60s from Gravenhurst, or have you been made aware of this, that a bank has closed its office today?
So that is new information for me. Thank you for that. We will look into that.
Okay, and so finally, we have our May long weekend come to go, and it appears that there has been infection with the local cottage population. Are you willing to call that a victory at this point, that there has been a serious uptick in numbers?
Yes, I am pleased, although we always need to be cautious. The timing is such we should have seen it by now, right? So, I would call that a victory to date.
All right, terrific. Thank you for your time today.
You're welcome.
Okay, Elizabeth Smith from Rogers. You have a question for Dr. Gardner.
Yes, thank you so much. I'm hearing a conversation around smaller communities about citizens becoming complacent, saying there, quote unquote, aren't that many cases in my community, or they're really low cases. What would your instruction be for those people who are starting to feel unconcerned?
I would say that I sympathize with the view that it will be a good thing when the province announces that we can extend our social bubble or increase, by that I mean associate closely with more than just our household, pick one other household or a total of 10 people and make that the group that associates closely, and only that group, not that you have overlapping groups, or that the province increases the number of people who can associate out in the community. Right now it's no more than 5. If they were to increase that to 10, that would be, I think, a good thing for our social well-being, our mental health. I look forward to that. But the province hasn't done that yet, and I think it's important for people to continue to be careful. Even once you go there and you end up with those changes, we will always need to be careful until this pandemic's been brought to an end with vaccination next year or whenever it would be. We're always going to have to exercise that physical distancing with many, many people, most people. It's just a question of when can we increase the numbers of people that we can be closer to. I guess I would ask people to have patience and still be cautious and still abide by the restrictions.
Okay, thank you.
You're welcome.
Okay, for anyone online I may have missed. Okay, I think that is it then. We will see you all on Friday.
Thank you very much.
Thank you.
Thank
Goodbye.
you.